Hi everyone, my name is Anya and today I will be representing the affirmative position on mandatory immunization for public school attendance in Ontario. So as you can see, here is the outline. In this presentation, I'll cover the resolution and definitions. In the background section, I'll discuss legal context and explain why schools are at risk, leading to the contentions and finally the conclusion. The resolution states that only fully immunized children with only medical exemptions are allowed to attend public schools from kindergarten to grade 12 in Ontario. The aim of this is to protect public health and to ensure fairness in access to education. Okay, so here are some definitions relevant to this presentation. Fully immunized refer to the completion of all vaccines required under Ontario's Immunization of School Pupils Act, as per Government of Ontario 2025. Attendance is legally mandated for children aged 6 to 18 under the Education Act, and it means a child's physical presence in an approved educational program, unless excused for illness, the completion of secondary education, or enrollment in an equivalent private or homeschooled program. Medical exemptions must be verified by a healthcare professional, while non-medical exemptions include conscientious or philosophical beliefs. Those are the subject of this debate. And finally, we have the World Health Organization definition of herd immunity as the proportion of immune individuals required to prevent disease spread. So, for example, approximately 95% of the population need to be immune to measles to prevent the spread and the outbreak of this disease. To gain better understanding of the situation, I will go through some points about the rights and freedoms and the legal context of vaccines. Ontario's Immunization of School Pupils Act requires vaccines but still allow the non-medical exemptions. The Canadian Charter of Rights and Freedoms allow reasonable limits when justified in a democratic society. That means that public health protection can constitutionally outweigh individual preferences when the risk involves community safety, especially in a school environment where transmission risk is high. So why schools at risk and what's the role of vaccines? Schools are high-density spaces where children spend hours together every day, which accelerates the spread of infection. For example, we have measles is one of the most contagious diseases with basic reproduction number ranging from 12 to 18, as reported by Bolton et al. 2019. Two doses of MMR vaccine offer up to 99% efficacy, but we have unvaccinated pockets create pathways for outbreaks according to CDC 2025. So now that I mentioned some important information in the background section, I'm going to move to the contentions. My first contention is the importance of herd immunity. To get better idea about the magnitude of herd immunity, I will cover some important data about the current measles situation and the herd protection in Ontario. Ontario's sero-epidemiologic data indicates that immunity amongst 12 to 19-year-olds is significantly below the 95% threshold required to prevent measles spread, according to World Health Organization 2025. So if you have a look at this graph, you will see that there is 2% immunity gap that leaves thousands of people vulnerable to measles outbreak. This gap is leading us to the measles outbreak case. So during 2024-2025 outbreak, Ontario saw over 2,000 cases of measles, with nearly 7% hospitalized and 0.5% of them needing an ICU care. 95% of those patients were unvaccinated, according to Public Health Ontario 2025. And unfortunately, a child under the age of 5 years died from measles. This is the first case of death over a decade. And according to Public Health Ontario's statement, the child required hospitalization and was not vaccinated against the virus. So we can see now and clearly understand the risks associated with gaps in herd immunity. So how herd immunity works? High vaccine coverage interrupts transmission chains. Fewer index cases lead to fewer outbreaks, according to World Health Organization 2022. Again, CDC confirms that at least 95% coverage is necessary to prevent a surge of measles outbreak, as we mentioned before. So herd immunity gaps allow the non-medical exemptions to jeopardize that threshold and directly endanger vulnerable peers who cannot be vaccinated, such as infant, immunocompromised individual, or those with medical contraindications. If you ask me, does repealing the non-medical exemptions works? Yes, it does. We have a case in New York State, 2019, where non-medical exemptions were repealed under the Senate bill number 2994A. This resulted in increased vaccine coverage by 5.5% in non-public schools and by 0.9% in public schools, as reported by Carrera et al. 2024. Moving on to contention number 2, how vaccines help with economic resilience. Unvaccinated or undervaccinated students who were in contact with measles case may be kept out of school up to 21 days after their last exposure. These precautions are done by Ontario Ministry of Health. They are there to help prevent transmission if the exposed individual later becomes infected. So when people miss schools, when children miss schools for 21 days, of course, the parents gonna have missed work days and they're gonna lose wages. So immunization keeps children healthy enough to attend school and reduce missed work days for parents. Also, I want to highlight healthcare expenses associated with an outbreak. So according to Public Health Ontario 2025, during the measles outbreak, the average hospital stay was 3 days and ICU stays were 3.5 days. Investment in immunization give a high return. Each dollar spent save multiple dollars in healthcare and productivity losses. On a macro scale, vaccines have saved an estimate $2.7 trillion US dollars globally, according to Zhu et al. 2024. Moving to contention number 3, vaccines promote equity. Vaccination support many UN Sustainable Development Goals. We have less poverty, which is Sustainable Development Goal number 1, and we have good health and well-being, which is Sustainable Development Goal number 3. Mandatory vaccination for non-medically exempt individuals promote education, equality, and poverty reduction, since mothers and caregivers benefit when their children are protected. Education and health are interlinked. Historical data confirm that 1967 to 1968 U.S. measles eradication campaign improved child health and long-term educational attainment, especially among disadvantaged groups, which reduces disparities in learning. And finally, to conclude, schools are high-density settings where diseases spread quickly. The herd immunity threshold for measles is 95%, but Ontario's immunity levels are below that threshold. Vaccines are already mandatory under Ontario's Immunization of School Pupils Act. Our argument is simply to remove the non-medical exemption loophole. This policy strengthens the herd immunity, supports economic resilience, and promotes equity. Mandatory immunization for school attendance is not about restricting freedom. It is about safeguarding collective health and ensuring every child's right to safe education. Thank you.